Hi everyone, I'm Dr. Cynthia Rajiv. I work as an emergency physician at Stanford University in California. In this module, we'll talk about vaccines. Joining me for this discussion is Dr. Jennifer Newberry. Welcome.
Hello, I'm Dr. Newberry, also an emergency physician and faculty at Stanford University. I'm excited to talk with you all about vaccines.
A quick reminder before we start. While we will talk a lot about COVID, this video series should not be used for personal medical advice. If you're worried about your own health, please talk to your doctor. They can help you decide, for example, whether to get a vaccine based on your own health history.
We may also talk about legal issues that have come up during the pandemic. Our aim will be to make you aware of these, but once again, you should talk to a lawyer if you have any legal concerns of your own.
We want to re-emphasize that the science around COVID-19 is constantly evolving. This is especially true with vaccines. While some basic information will still stay the same, like the steps that vaccines must go through to make sure they are safe, we are going to learn a lot of new things in the next few months as more vaccines get approved and new data is collected. The information in these videos is the most up-to-date to our knowledge at the time of recording.
And finally, we have no financial conflicts of interest to declare.
There's a lot to talk about vaccines. In this module, we'll cover what the different vaccines are and how they work in the body. We'll talk about how we know that these vaccines are even safe for us to get. And finally, we'll go over how well the vaccines work, side effects, and logistics, so that you can understand who can get the vaccine and what to expect.
That all sounds great. Let's jump in.
At the time of this recording, more than 7 different vaccines have been administered around the world. The World Health Organization, WHO, has approved 3 vaccines, and the United States Centers for Disease Control and Prevention, or CDC, has also approved 3 vaccines. Dr. Newberry, could you tell us how these vaccines work?
Yes, absolutely. All the vaccines approved by the WHO and CDC fall into 2 types. There are mRNA vaccines and viral vector vaccines. In the past, most vaccines contained dead virus, which was introduced into the body. Your body would recognize the dead virus as an outsider and prepare the immune system to fight the virus in the future. Both types of SARS-CoV-2 vaccines, the mRNA and viral vector, are clever. Instead of putting the virus in your body, the vaccine tells your body how to make a particular unique piece of the virus. In this case, the unique and harmless piece is SARS-CoV-2's spike protein. When your body receives these instructions, your cells make copies of this spike protein based on the instructions. Your immune system will recognize the spike protein as a stranger in your body, and in response will prepare antibodies that in the future will detect and destroy cells that have SARS-CoV-2 spike proteins.
Okay, that's a lot of information. Let's think about this another way. Imagine you hear a new song on the radio that you've never heard before. You're not really paying attention to the lyrics, but the chorus tune gets stuck in your head. Later, you hear the song again, playing in a store while you're shopping. This time you recognize it. You still don't know the full song. That is, you couldn't actually sing the full song if someone asked you to. But knowing the chorus was enough for you to recognize the song when it started playing. You didn't actually need to know all the lyrics to know what song was playing.
In this example then, the song is like the SARS-CoV-2 virus, right? And the chorus is a spike protein, a small but recognizable piece of it. The mRNA in this vaccine teaches the body how to make the spike protein, which is like teaching us the chorus of a song only, but the chorus alone isn't the whole song.
Exactly. However, knowing the chorus is enough for you to recognize the song when it comes on. Just like seeing the spike protein is enough for the body to recognize the SARS-CoV-2 virus should it ever appear. And that is crucial here. The vaccine teaches your body to recognize the SARS-CoV-2 virus in advance without the risk of delivering the whole virus. Okay, now we know how the vaccine works. What about safety?
Like all vaccines, COVID-19 vaccines have gone through rigorous testing to make sure they are safe before being approved. And because COVID-19 was affecting many people all around the world, vaccine trials were able to enroll a large number of people from diverse populations. For example, the trials for the CDC-approved vaccines by Moderna and Pfizer included over 30,000 people in each trial. This is a lot more than other vaccine trials.
What about who was in these trials? Were people from different countries and races included? What about women and children?
As mentioned before, because COVID-19 had spread around the world, the WHO and CDC approved vaccine trials were able to be conducted in Brazil, Argentina, South Africa, Turkey, Germany, Belgium, the US, and the UK. For example, Pfizer's vaccine, one of the WHO and CDC approved vaccines, had around 28% of participants who were Hispanic, 9% of participants who were Black, and 4% of participants who were Asian in its trials. And at least 50% of all participants were women.
That's wonderful that the trials included people from around the world.
Yes, absolutely. That also helped with the speed.
Speaking of speed, should people be concerned how quickly the vaccine was approved? Were safety steps skipped?
This is also a really important point to discuss. No, we absolutely did not skip any safety checks. What we did do is combine some of them. As a really simple example, let's return to our music analogy. Pretend you and a friend are writing a song. He is writing the lyrics and you are composing the music on a guitar. The slow way to do this is to wait until he has written all of the lyrics. This would be step 1. He will then give you the lyrics, and once he is done, you then compose the music to go with it. This would be step 2. And this is how we've done most vaccine trials in the past, step by step. Now imagine that you want to speed up the process. So instead, you and your friend sit down together and you decide to do both things at the same time. He works on writing the lyrics while you work simultaneously on coming up with a cool melody. This greatly accelerates things because you don't have to wait for him to finish his lyrics first. But it doesn't actually affect the outcome, which is a catchy song. With the COVID vaccine, this is what scientists did. Rather than testing things step by step, for example, safety and then how well the drug worked, scientists did several steps at once, testing different things in the same trials.
Multitasking definitely helps. And of course, it also helped to have everyone in the world concentrating on the same disease at once. That rarely happens.
Yes, we really can't estimate that power for several reasons. First, so many scientists were researching SARS-CoV-2 at once to figure out how to make the vaccine. And the wonderful thing is we already knew a lot about the virus because of similarities to other coronaviruses, like SARS and MERS, which gave us a great place to start. Second, funding in the medical world normally has to be split between a lot of different diseases and groups. Scientists are researching different conditions and are constantly competing to get money for the diseases and causes they are personally researching, which means that the money gets divided up. And third, there's usually a lot of paperwork and red tape that can drag on and make the process really slow.
What you're saying is that speed and money was on our side this time, right? Everyone wants to see the pandemic end, so everyone was funneling money into finding a vaccine. And every government body or approval committee involved was prioritizing studies on SARS-CoV-2 and its vaccine. So the paperwork was streamlined.
Exactly. The whole world working on one thing at the same time. Turns out you can get pretty amazing results doing it that way. So yes, it seems like we made the vaccine quickly because we did. And that is a wonderful thing. But speeding up that process had nothing to do with decreased safety and much more with the prioritization of the disease compared to how vaccine processes usually work. The vaccine still went through every single safety step, and studies are continuing to show that it is very safe for us.
Now that we've discussed vaccine safety in general, I would love to hear your thoughts on specific concerns people have around the COVID-19 vaccine. For example, some people worry the vaccine itself can give us COVID-19. Thoughts?
No, it is not possible to get COVID-19 from the vaccine. The vaccines, mRNA and the viral vector, only have instructions on how to make a harmless portion of the virus, just enough to recognize it. The vaccine cannot teach your body how to produce the actual SARS-CoV-2 virus.
What about the mRNA itself? People are concerned that it's new technology.
The mRNA in this vaccine is safe. Our bodies make different types of mRNA every day. We would not be alive without mRNA. It's what allows life to function. This vaccine is the first approved vaccine that uses mRNA, but that does not mean that the technology is new. We have been researching and working on mRNA vaccine technology for over a decade. We know it's safe.
Really good to know. One other question. I've heard people worry that the mRNA vaccine can change our DNA.
No, that is not true. This vaccine cannot change our DNA, and that's because the vaccine mRNA never enters the nucleus of our cells, which is where DNA is found.
That is reassuring. Now that we know how the vaccines work and that no safety steps were skipped, how well do these vaccines work? What do we know from the trials and from vaccinating the public so far?
WHO standards require that for any vaccine to be considered successful, it must have at least 50% efficacy. In trials, the approved vaccines were all more than 70% effective. This means in the Pfizer vaccine trial, which was 95% effective, for every 100 people in the unvaccinated group that had COVID-19 with symptoms, only 5 people in the vaccinated group had COVID-19 with symptoms. And the real-life results are also excellent. After vaccinating over 66 million people in the US, only 0.008%, that's far less than even a single percent, of people have breakthrough cases of COVID. That's huge. These vaccines really do work.
Excellent. There's a lot of discussion about variants. How does this affect the vaccines?
There is evidence that current vaccines may not be as effective against some variants. In fact, this may contribute to the difference in efficacy between early vaccines in trials and newer ones. When the early vaccine trials were done, the variants were not common among study participants, but when the most recent vaccines were undergoing trials, the new variants were more prevalent in the population. Despite the new variants and slightly lower overall efficacy in trials, all the vaccines significantly reduce the risk of serious complications from COVID, such as hospitalizations and death.
That is very reassuring. What might people expect after they get the vaccine? What side effects?
Side effects are real, but it is important to understand that the side effects are almost always a sign that the immune system is doing what it is supposed to be doing, responding to the vaccine and producing antibodies that can then protect people from the real virus.
So what you're saying is that side effects are not a sign that the vaccine is harmful. Quite the opposite. They are a sign that the vaccine is successful.
Exactly. The side effects we're seeing are all normal and expected with vaccines. These include things like pain at the injection site, fever, and fatigue. With vaccines that require a second dose, some people are experiencing chills and body aches with the second dose. These side effects usually start within a day after receiving the vaccine and last only about 12 to 48 hours.
And let's not forget, these side effects are mild and temporary compared to what COVID can do to people. Okay, so we expect side effects, but what about allergies? Is that something people should worry about?
Good question. First, check the ingredients in the specific vaccine that you are getting. For example, there are no egg products in Pfizer, Moderna, or Johnson & Johnson vaccines, so people with an egg allergy can get it. But there are 2 ingredients in some vaccines that are known to cause an allergic reaction for a few people. First is something called polyethylene glycol, or PEG for short. Meanwhile, other vaccines may contain polysorbate, which on rare occasions some people are allergic to. People who have a PEG or polysorbate allergy should talk to their doctor to determine if they should receive the COVID-19 vaccine. This decision is based on how severe their allergic reaction was in the past and their risk of exposure to COVID-19 and poor outcomes.
What about people who've had severe allergic reactions to other things, like other medical products or even bee stings?
People who have had anaphylactic reactions to anything in the past should be sure to tell the person vaccinating them before the vaccination. People who have allergies should discuss the risks and benefits of getting the vaccine, as mentioned before, with their doctor. However, as a general rule, patients who do not have an allergy to an ingredient in this vaccine should be able to get the vaccine. Anaphylactic reactions to the COVID vaccine are extremely rare. Nearly all cases of anaphylaxis occurred within 30 minutes of the person receiving the vaccine. That said, it can happen, but very rarely. Anaphylaxis is something medical providers know how to treat. So if a person has a known history of anaphylaxis, medical professionals should observe that person for a full 30 minutes after immunization, rather than the standard 15 minutes, in order to identify and treat anaphylaxis.
Excellent. How many doses of the vaccine need to be taken?
It depends which vaccine you are receiving. Most of the approved COVID-19 vaccines require 2 doses, but the Johnson & Johnson vaccine, for example, requires only 1 shot.
Why do some vaccines require a second dose?
For the vaccines that require a second dose, after the first dose, the body begins to create antibodies, but as the weeks pass, this response will drop a little. When the second shot is given, this reminds the body about the virus and ramps up production of antibodies again to maximize production that will last longer than 1 dose.
Great. So how long do I need to wait before getting the second dose?
That depends on the vaccine. For example, Pfizer, you will need to wait 21 days, and for Moderna, you'll need to wait 28 days.
That seems very precise. What happens if I can't get there exactly on day 21?
It's okay if you can't get the second dose exactly on day 21 or day 28, but we recommend getting it as close as possible to that 3rd or 4th week mark.
Okay, let's now talk about vaccine recommendations for some specific groups of people, starting with people who are pregnant.
Sure. The WHO and CDC do not exclude pregnant people from getting the vaccine. But here's a few things to consider. 1, pregnant people who get COVID-19 are at higher risk of getting severe COVID-19, so protection may be especially important. 2nd, pregnant people were not included in the vaccine trials. However, all of our previous experience with vaccines and the way these vaccines work give us no reason to believe that the pregnant person or the fetus would be harmed by the vaccine.
So ultimately, it sounds like people who are pregnant can choose to get the vaccine, but that they should weigh their risk of exposure. Oh, and while we're on the subject, I'll add one thing. The Moderna vaccine is approved for people 18 and over, and the Pfizer vaccine is approved for people 16 and older. So we do not have data yet on how the vaccines work for children, but trials are underway right now. Since this video was first recorded, recommendations have been updated, and trials now have included pregnant women and children. These are the updated recommendations. What about people who are immunocompromised or who are taking immunosuppressant medications, like those with cancer, HIV, or rheumatoid arthritis, for example?
The WHO and CDC advise most people with immunocompromising conditions or medications to receive the vaccine, but they recommend they speak with their doctor first to consider options based on their specific medications and conditions.
And what about people who already had COVID-19? Do they need the vaccine? Or should they wait?
Right now, the WHO and CDC recommend that every eligible person be vaccinated, including those who have already had COVID-19 in the past, because you can get infected again. Immune protection from COVID-19 infection should last at least 90 days, and so people may choose to postpone vaccination in order to allow the doses to go to other people. One important thing to know, people who are actively sick or having symptoms should wait to receive the vaccine until they have recovered.
How soon after getting the vaccine am I protected?
And that depends on the vaccine. For single-dose vaccines, maximum protection can take up to 4 weeks after the injection. Meanwhile, for those vaccines that require 2 doses, it can take up to 2 weeks after the second dose. You are not well protected after the first dose alone.
And we all must continue precautions because even if we're vaccinated, we may be able to get infected with the virus, have no symptoms, and possibly transmit it to others.
Exactly. And while someday we hope to be able to stop wearing masks and social distancing, it will depend on vaccination rates and continuing to follow the data.
We'll end this video with a quick personal story. We're excited to introduce you to a wonderful community health worker, Rose Martinez. She received the vaccine and will tell you why getting vaccinated was important to her.
Hola, soy Rose Martínez, soy promotora de salud del condado de Santa Clara. Yo me puse la vacuna del COVID-19 para protegerme a mí y para vivir muchos años con mis hijos y mis nietos. Gracias.
Let's quickly review what we learned about vaccines.
First, we talked about how the vaccines are safe for your body because it only teaches your body how to recognize the real virus. The vaccines do not change your DNA and they cannot give you COVID-19.
Next, we talked about the vaccine production timeline. We learned that no safety steps were skipped, and the reason we got a vaccine so fast is because everyone was working together, directing money and efforts towards creating this vaccine, and because multiple steps were done at the same time. We discussed the trials, that some of the earliest trials included over 40,000 people, which is more than in past vaccine trials, and these participant groups were diverse in gender and included different races.
We also saw that COVID-19 vaccines have been really successful so far. We then explored what side effects can occur with the vaccine and learned that side effects are a sign that your immune system is doing what it's supposed to do in response to the vaccine. We also discussed possible vaccine allergies and anaphylaxis. Remember, you should always talk to your doctor about any health concerns.
Finally, we learned that the CDC and WHO say pregnant people Most immunocompromised people and people who previously had COVID-19 may all choose to get a vaccine. Although, again, it's recommended to talk with your doctor first about your specific scenario. And we ended by reviewing that maximum protection from the vaccine can take up to 2 to 4 weeks after the final dose, and why we should continue precautions after vaccination. Thank you, Dr. Newberry, for your time and your wisdom.
Thank you. And thank you all so much for sticking with us through all of this. We hope you found this video educational and empowering.